morning, everyone, and thank you for joining us. So I'll start with a brief update on the numbers. We are seeing some indications of a plateau. The total number of cases we have is 230,089 cases of COVID-19 reported. We're averaging close to about 3,000 on a daily basis. And the case rate is at 190 per 100,000. This is data from yesterday. For comparison, last week it was 189. So there are indications that we're hitting a plateau. When you look at the hospitalizations, they have increased from 505 from the last report to 588. Intensive care unit from 82 increased to 92. And pediatric hospitalizations have increased from 14 to 22. The ED visits have decreased slightly, and you can see that on our dashboard and be able to follow what the numbers look like. For the jail, there are currently 47 cases of COVID-19 in the main jail compared to 76 last week on the 12th, and currently 123 cases in RCCC compared to 49 on the 12th. We continue to provide consultation with correctional health and in helping to make sure that cases that are identified are isolated. And we also provide assistance with testing. Vaccination remains the safest strategy to prevent future infections, severe disease, and death. And so we remind everyone to continue to be vigilant with masking in public places, and for those that have conditions that put them at risk, to avoid gatherings, and for people that are exhibiting symptoms to stay home. Last week, we were asked about the therapeutics, so I want to give you a brief update on the therapeutics that are allocated to Sacramento County. We are getting, and this is on every 2 weeks, we get an allocation, and then what we do is we then reallocate it to the different facilities and send that information to the state, which then sends it to the company that ships out the medication. So there is Paxlovid, which is an oral medication for treatment of mild to moderate COVID-19. We get about 300 allocated to Sacramento County with each allocation. And we usually have about 10 locations that get the reallocation, and that does include our jail facilities. The jail facilities get about 20 each. They're still in the process of getting their first allocation. Molnupiravir is also an oral medication for treatment of mild to moderate disease. We get about 1,220, and that is allocated to about 30 to 40 facilities, which does include CVS and Rite Aid pharmacies. Then there's Evishield, which is an intramuscular injection. It's given for pre-exposure treatment for people that are immune compromised. So there are only 2 facilities in Sacramento County that get that at UC Davis and Sutter. And this is actually a regional resource. So they get referrals, not just from Sacramento County, but from the entire region. And then Sotrovimab is an IV injection, which is a monoclonal antibody treatment. We get about 180 doses, and this is distributed to hospitals. So as you can tell, we do get very limited supplies, and that is given out to the different facilities for treatment of patients. I will turn it over to Jamie.
Hi, good morning. For the past week, our Stanford wastewater group has detected decreases in SARS-CoV-2 concentrations in wastewater from Sacramento and several Bay Area wastewater treatment sites. Since these changes have occurred over several days, it looks like there is a true decrease in SARS-CoV-2 circulation and not a random fluctuation of Omicron in particular. In terms of variants, I do want to remind everybody that we are still seeing Delta in addition to Omicron. So Delta has not gone away. Several of the genotyping results that we're getting back are coming back as Delta. This may be somewhat influenced by a prioritization over more severe cases for genotyping, but there is no guarantee that if somebody gets COVID infection today, that it's going to be the Omicron variant. And so people should be very cautious about that. I'll turn it over to Nick.
Thanks, Jamie. Good morning, everyone. I'm going to talk a little bit about schools and also some home test kits. So as with most sectors in our community, schools have felt significant impact from this current surge, which unfortunately occurred right as schools were returning from their winter breaks. Schools have seen higher numbers of cases amongst students and staff than previously, which is consistent with high case rates across the entire community and does not necessarily indicate that transmission is occurring on campus. Prior to this most recent surge, due to individual level contact tracing, we were confident that most students and staff who got COVID acquired it outside of school, either from family or at social gatherings. The high case rates we are currently experiencing in our community make it difficult to identify how an individual acquired COVID, as they may have multiple exposures per day in a variety of settings, both at school and away from school. We know schools are essential to the emotional well-being of children, and keeping them open for in-person instruction remains a priority. There are no set thresholds for school closures, and our office provides consultation to schools that believe they may have a situation that warrants a closure on a case-by-case basis. Thus far, there have been a small handful of brief classroom closures, but schools have in large part remained open, and we're optimistic that that will continue. As we deal with this current surge, we continue to encourage schools to remain focused on universal face covering usage, and the importance of being fully vaccinated and boosted if eligible remains clear, especially for lessening the chances of serious disease, hospitalization, or death. The last 2 years have been challenging for many businesses and organizations, and schools are no different. First, as they adapted to offering distance learning, and now as they implement COVID testing programs, partner on vaccine clinics, and conduct contact tracing for their students and staff. This most recent surge has created staffing shortages for many schools, and it has been all hands on deck as teachers, counselors, and administrators have stepped up to cover classes. We remain committed to continuing to support them through the provision of guidance and technical assistance. So regarding some information on testing, Sacramento County Public Health has provided rapid antigen test kits through a variety of channels, including a wildly popular distribution to the general public through a recent partnership with Sacramento Public Library, as well as distributions to community-based organizations. Separate allocations of test kits have been sent to schools through the Sacramento County Office of Education. Demand for rapid antigen home test kits throughout the community remains high. We want to remind residents looking for home test kits that they can order them for free through a new federal program that allows each household to order 4 home test kits. Kits can be ordered online at covidtests.gov and are expected to ship starting late January. As a reminder, this is a federal program and not affiliated with Sacramento County Public Health in any way. It's simply another resource we wanted to share in hopes that our residents seeking home test kits can benefit from it.